and then breathing out is a passive process. And we'll see what I mean by this very clearly. So there are three phases of breathing. One is called inspiratory phase, one is called expiratory phase, and one is a respiratory pause in between. So actually respiratory pause should come in between these two. Okay, after the inspiratory phase, there is a respiratory pause. That pause is needed for us so that gaseous exchange can occur, and then there is an expiratory phase. So inspiration, then exchange, and then expiration. So remember, we have got two lungs, but I've taken one lung, and I'm going to tell you with the help of this, and then we will see how it actually is happening. So we'll take this lung to be a six-sided box. Okay, in three dimensions, of course, box is six-sided, not four-sided like we actually think. And this box, if I can manage to increase the diameters of this box, okay, so if I can make this box bigger than it is already there, okay, in which case what will happen is, if this box becomes bigger than the black color, the blue color, the red color, then so much space is more. In every dimension, anterior, posterior, medial, lateral, and superior, inferior, in all three dimensions, the space has increased. Okay, and this space has increased. This space which has increased. Now, how the space increases in physiology, they'll tell you between the two pleura, the pressure difference, and all that will explain to you in details in physiology. What I'm going to do is I'm going to increase the space, and then when this space is increased, this is a newly formed space. This space is newly formed. It was not existing. It is formed just now. And when this newly space is formed, it has got no pressure inside. So it is no pressure, or we say zero pressure, or other words, people use that this is a vacuum. There is no pressure inside. It is going to act like a vacuum. So what will it do? If I connect this box to the exterior via the means of trachea, bronchi, etc., if I connect this to the atmospheric air is under atmospheric pressure. Please remember that is under atmospheric pressure. Farooq, Dr. Farooq, mute yourself. So this is 150 is 560 centimeters of pressure, but this is atmospheric air. Because this is under pressure, there is atmospheric pressure here, and there is no pressure inside this extra place. Inside the extra place, there is no pressure at all. There is absolutely no pressure. No pressure because the space has just been formed, so there can be no pressure inside it. The air being under higher pressure than that, air rushes into this. So air comes into this, fills up this much place, becomes so big, and that is how air is coming inside. Okay, so little more we will see afterwards where the air is going in and all that. Right now, our intention is to increase the six sides of the lung. The lung has got AP diameter, medial lateral diameter, and side to side diameter. So all diameters we have to increase. Out of all these diameters, the biggest one is the diaphragm. Okay, the diaphragm, when it contracts, so this is in lateral view, these two diagrams in lateral view, these two diagrams in anterior posterior view. Okay, so let's say there's nothing like resting, but suppose we take a resting thing or the end of the expiration. So when expiration is over, the diaphragm is like this. You know, the diaphragm is like an open umbrella. So diaphragm is like this. When we want to inspire, what happens is the diaphragm contracts. This diaphragm, when it is contracted, it is coming like this, correct? Because it is coming like this, because it has become more flat, and there are two domes of the diaphragm. Diaphragm has got two domes, right dome and left dome. Two domes of the diaphragm are there. This whole diaphragm contracts, and the diaphragm becomes almost something like this. So the distance from wherever we are starting to this. To this distance, it has increased. This distance, if you notice, same place from where we started, this distance has increased. So the superior inferior diameter, that is from above downwards, superior inferior diameter of the thoracic cage has increased. Okay, that means when we are looking at it here, this is where the line passing through the diaphragm was. Now the line passing through the diaphragm is here, and therefore so much place has increased. Okay, please note that the apex of the lung, what happens here? That the apex of the lung is always kept above this, because hardly the apex is going to move. See this, the apex of the lung is kept above. Okay, it is this diameter which is going to increase, superior inferior diameter is going to increase, and one diameter we have increased by the contraction of the diaphragm. So when the diaphragm contracts, it's an active process of contraction. Okay, now what happens is, when we look at it from the front, these are the two domes of the diaphragm, and when it has contracted, it has become like this, telling you that this space has increased. This is superior inferior diameter diagram only. Let's see at other diagram. So this is diaphragm, right? When it has contracted, so it has pulled down towards the abdomen, this size has increased, and when it relaxes, this is what is going to happen. The size of the lung is coming down. Okay, and even whatever chest size had increased, it is basically the chest size. Right now I'm talking about, even if I use the word lung by mistake, it is not lung that I'm talking about. I'm talking about the thorax. So we're talking about increasing the size of the thorax, and therefore see, this was there in inspiration. Now it has come to expiration like this. Okay, so this is only one muscle, that is diaphragm, that is contracting, and its nature contribution is from the diaphragm, which helps us in breathing. And that is increasing the superior inferior diameter. Now let's see other diagrams, and then we will understand. This is still showing same thing. Diaphragm has come down, and the space has increased, and the full chest has gone outwards like that. And during expiration or exhalation, it is coming down, and this has gone up like this. It has become more of a dome again. Please remember that these diagrams which have been drawn to explain to us are wrong. It is not that the diaphragm has got a single dome. The correct is that again here it is showing, this is the lateral view, so it is correct that there is a single dome, but in reality there are two domes, the left dome and the right dome. Okay, so two domes of the diaphragm are there, and it becomes flat. Now, what I'm going to talk to you is about two different things. First, we understand them separately, and then we are going to do it together. This is the bucket. This is its handle. And when this handle is touching the bucket, but if I lift the handle, then there is a space between the bucket and the handle. And therefore, this type of movement which is going to occur in the chest is known as the bucket handle type of movement. Another is, you have heard of this pump in PSM, right? Preventive and social medicine. The handle of this pump is here. When water is not being pulled out, we want to pull out water, then we take the pump up, then again down, up and down. And this movement, see this distance, and this distance. So this distance. So this distance is definitely increased when the handle goes up. Similarly, in bucket also, when this moves here till here, this much distance has increased. Otherwise, it is touching the bucket. So in both of these movements, bucket handle type of movement and pump handle type of movement, when this type of movement is done, the space will increase. So this is happening not in the thorax. Now we will see how it happens in thorax. Okay. So coming down, this is the rib which is articulating with the vertebra. Correct. This rib, when it articulates with the vertebra, it forms a joint there called costovertebral joint. And the muscles which are going to pull this will, when the muscles which are there between the ribs, when they contract, they are going to form movement here. Okay, and then we will see this movement name is what they're going to do, how they're going to do. You don't break your head. Okay, what you understand is that when this muscle is contracting, the movement is occurring here at the head of the rib, where I showed you between the head of the rib and the vertebra. Okay, this is pulling the muscle up. These are pulling the muscles up, and when we keep the first rib fixed, if the first rib is fixed, the muscle which is there in between these, like this muscle contracts. This is the muscle, and when this muscle will contract, it will become this size. Size is becoming small. So this rib is pulled towards this rib. So rib number, if you take this as rib number 4, rib number 4 is pulled towards rib number 3. Similarly, rib number 5 is pulling at rib number 4, and so on and so forth. Okay, so they are pulled upwards. Because they are pulled upwards and they are attached anteriorly to the sternum. So the upper 7 ribs are attached interiorly to the sternum like this, all of them. When these are pulled up, what happens to the sternum is that the sternum goes forwards like this. This movement of the sternum, so beyond, it is behind this line. Now it has gone in front of this line because each rib is turning like this and it is lifting the sternum. Rib position is like this. The posterior end is higher up, anterior end is lower down, and it is attached to the sternum. Okay, so when it moves, it will pull the sternum like this. When it pulls the sternum like this distance increases. So the tension is increasing. Again, let's see in different diagrams. So that is this movement. This is known as the caliper movement, right? What is happening here? See this, because this rib is moving, the sternum is coming forwards. Okay, so when these ribs are contracting, you can see this black rib, and then it is becoming red like this, and because it is attached to the sternum has moved forward. Here also you can see the rib is attached to the sternum, and because it is, the muscles are contracting, the rib is pulled up, and because the rib is attached to the sternum, it is coming forward. So anterior posterior diameter of the thorax increases because of the contraction of the muscles which are between the upper ribs. Upper ribs means those ribs which are attached to the sternum, and therefore they can pull the sternum forward, and therefore the anterior posterior diameter increases. If you look at the ribs which are lower down, these are upper ribs still. If you look at the ribs which are lower down, what happens is that the ribs which are lower down are not attached to the sternum. See, for example, this diagram, these are the ribs which are not attached to the sternum. This is the sternum, right? This is 7th costal cartilage and 7th rib and its costal cartilage. The 8th costal cartilage is attached to the 7th costal cartilage. Okay, the 9th costal cartilage is attached to the 8th costal cartilage, and 10th costal cartilage is attached to the 9th costal cartilage, and that's how we get the subcostal plane. Okay, that is like that. Now the subcostal plane is because of the Costal cartilages of 10, 9, 8 are attached to the 7th costal cartilage indirectly. Means they have not, the rib has, the other ribs which were attached to the sternum came till the midline. Midline means till the sternum. They came till the center. Whereas these ribs are going to end somewhere here only. They are not coming till the center. They are not reaching till the center. They are on the sides. And as the length of the thorax goes on increasing, these lower ribs are broader. They are broader. That's how the thorax becomes like this in shape. For it to become like this in shape, these ribs definitely are broader. And they are not coming all the way till the sternum. They are ending somewhere here only. Okay. Now the same muscles which are acting at the head of the rib, these muscles only when they contract, what happens is that the rib rotates. Rib rotates. Like you can see here, this rib is rotating like that. Okay, the rib is rotating. So the rib which is here, the anterior end down, posterior end up, it does not come to the towards the center like the ribs which are attached to the sternum. Now it is here. So the head being in the center, the rib is still on the side. So when those contract, it will do like this. Okay, when it does like that, this is what is the diagram. When it rotates like this is what is happening. So from here, this is moved to that. So from here, it has moved and see this distance has increased. Okay, of course, this is a lateral view. This is also a lateral view. So what we are seeing is this is the anterior, this one, this rib has rotated. So this distance has increased, the red one. So this is seen from behind because the lower ribs are more prominent, from easily seen from behind. From anterior, like I told you, the costal cartilages are attached to other costal cartilage, but from posterior we can see the rib clearly. So the rib has literally gone up, but this going up is such that it is also rotating like that because it is not attached to the sternum anteriorly, and because of that, the side to side diameter increases. So the bucket handle type of movement will increase the side to side diameter. The pump handle type of movement will increase the anterior posterior diameter, and the contraction of the diaphragm will increase the superior inferior diameter. Now, all three diameters are increasing. These are diagrams shown to you. This is increasing anterior posterior. This is increasing the side to side diameter. You can make out how this has gone up, right? And you can see that this is how the thoracic cages, as we come down, the ribs are broader, and these ribs are not coming towards the center. They are ending in the costal cartilages of the rib above, and therefore these cannot, like the upper ribs, it cannot bring the sternum in forward, and it is only rotating like this because it is not attached to the sternum. Okay, so a combination of all three of these increases the size of the thoracic cage. Increases the size of the thoracic cage or increases the size of the lung, whichever word you want to take. Better we take the increases the size of the thoracic cage. Now, attached to the inner aspect of the thoracic cage, that means from the inner side of the thoracic cage, there is this blue colored pleura. Okay, so the blue colored pleura is attached on the inner side of the thoracic cage and onto the upper side of the diaphragm, onto the upper side of the diaphragm, inner side of the thoracic cage, the one which is blue in color. Okay, and I told you yesterday it is going beyond the lung and the visceral pleura. This is in the anterior clavicular line. It is anteriorly in the mid clavicular line. It is going down to here. Then in the mid axillary line, it is going down to here, right? Approximately till the 9th rib. And in the posterior line, posterior. Yesterday we had seen a diagram of posterior. It was going all the way till 12th rib. Okay, so what I'm trying to make you understand is that the parietal pleura is much lower than the visceral pleura. Okay, these two are not in contact with each other. Like in the heart, what happens is, in the heart, this is heart, and this is the visceral pleura. This is visceral pleura sticking to it. Just 1 second. So that is the visceral pleura. I mean visceral pericardium. And then this is parietal pericardium. Red line was visceral pericardium, black line was the heart, and this is the parietal. Though I'm making very broad, it is not so broad, but it is sticking to it. That's what I want you to understand. That the parietal and the visceral pericardiums are sticking to each other. But in case of the pleura, there is a space. There is a definite space between the visceral and the parietal pleura. And this space and this distance is there that they are going to help in physiology and make you understand exactly. Now we have increased the intrathoracic diameter right now. We have not increased the lungs diameter. Okay. So because of this pleura and because of the pressure changes of these two pleura, which we explained to you in the physiology part, the size of the lung can increase. That is, I'm just telling you, it will be explained to you. Now we are going back again to where we were and we are seeing what is happening. Okay, we'll take any of these diagrams and we continue. Okay, so because the box has become big, the lung which is there in it, because the pressure changes of the two pleura, the lung will also become big. Each of the two lungs, both of them will become big. Now, when they become big, or you don't even say they are becoming big, forget about it. Let's only take the pressure changes which are occurring in the pleura. And then what happens is because there's a negative pressure which we saw inside the thoracic cavity, and in the thoracic cavity there are two lungs.